Maddox Wing Productions.
Hi, this is an instructional video on how to perform a Maddox Wing test aimed for orthoptists. In this video, we will be explaining the following: parts of the Maddox Wing, the mechanism, indications of use, how to perform the test, how to record and interpret your findings, advantages and disadvantages. Indications of use. The Maddox Wing test is mainly used to measure latent deviations at NIA. Take note that it is also possible for small amounts of manifest deviations. It is used in association with other clinical tests to diagnose and measure strabismus, in particular latent deviations. It is particularly useful in patients complaining of symptoms for close work for which there is no obvious cause. Used instrument may reveal a small amount of vertical imbalance or possibly an unsuspected torsional deviation which could account for the symptoms. Parts of the Maddox Wing. The Maddox Wing comprises of various parts. The handle. The handle is retractable and is located at the base of the instrument. This is where the patient holds the apparatus. The eyepiece. Located anteriorly. The eyepiece is where the patient looks into. The scepter. There are two septa that separates the eyepiece so that the patient has two separate fields of view. The measuring board. Used to measure the deviation of the heterophoria and also torsion. The measuring board has the horizontal, vertical, and torsional scales. The board also contains the red and white arrows. This will be further discussed throughout the video. The torsion lever. On the measuring board, there's an adjustable lever which the patient attempts to straighten to measure for torsion. The eyepiece lens holder. Mainly used to hold the lens for patients who have difficulty seeing the board with their glasses. The mechanism. The Maddox Wing dissociates the eyes by the two septa. The septa are arranged so that the horizontal and vertical measurement scales are seen in the left eye and that the red and white arrows are seen on the right eye. Now we're going to look at how to perform the Maddox Wing test.
Okay.
Yes.
Nice to meet you. I'll be your office for today. Could you just go have a seat over there?
Make sure there is good lighting.
So today we're just going to do some eye tests on you. First we'll start off with this. So if you see this handle here, I'd like you just to hold that like that and just look through these holes like you're looking through glasses.
Okay.
Just try it up here. And just hold it as if you're looking to a book.
The instrument is to be held at reading position in the depression of about 15 degrees.
Do you see the white arrow pointing up?
Yes.
What number is that pointing to?
Pointing to the 2.
To the 2, and now
The vertical white arrow on the white axis scale measures for horizontal deviations. Odd numbers represent isodeviations and even number represents exodeviations. It is also important to note that dissociating the eyes may make the arrows drift, as shown here. It is important that time must be given for dissociation to take place. The number recorded is the number that the arrow is mostly on.
Now, is that actually pointing to the 2 or is it between the 1 and the 3?
The number 2.
It's actually pointing to number 2? Okay.
It is also very important to ask the patient if the arrow is exactly on the number or if it's in between two numbers, so the results aren't misinterpreted.
Okay, and now do you see the red arrow?
Yes.
What number is that pointing to?
It's pointing to the 0.
To the 0? It's on 0?
Yes.
Constantly 0. Good.
The horizontal red arrow on the red axis scale measures for vertical deviations. Odd numbers represent right hyperdeviations and even numbers represent left hyperdeviations. There is only one 0 on the measurement board, so it's not necessary to indicate if the arrow is pointing to the exact number or if it's in between two numbers.
This lever here,
Yeah.
I'd like you just to hold it so that it's parallel to the red arrow.
Okay.
Yeah.
Patients are asked to subjectively align the torsion lever. It is important to note that each line on the torsion scale equates to 2 degrees. The torsion alignment above the 0 line indicates in-cycle deviations. Torsion alignment below the 0 indicates X-cycle deviations. Torsion alignment on the 0 indicates no torsion. This is how you record your results for the Maddox Wing test. Horizontal and vertical measurements are recorded in prism diopters and torsion is recorded in degrees. Our patient without glasses on has a 2 prism diopters exo deviation without any vertical deviation. Torsion was absent, therefore not noted. Here's another way to writing the results with a different patient. Patient 1. This patient with glasses on has 10 prism diopters exo deviation with a 7 prism diopters right on left. They also have an X-cycle adduction of 4 degrees. Patient 2. This patient with correction has a 5 degrees ESO deviation with no vertical deviation. Note that the circle symbol with the horizontal line through it represents no vertical deviation, and a circle symbol with the vertical line through it represents no horizontal deviation. Important notes to remember. The examiner should check the function of the Maddox Wing instrument before use. The scepter is easily bent. Sometimes the scepter may not cover its intended view. When this happens, one eye can see both the arrows and the numbers, which gives inaccurate results. If the patient is wearing bifocal glasses, it may be difficult for the patient to look through the eyepieces. If this occurs, then an appropriate lens can be placed into the eyepiece lens holder. The number and arrows should also be clearly seen. Wrong measurements can result due to the relaxation of accommodation. This may give an increase in exophoria and a decrease in esophoria. The Maddox Wing can only be performed at near, which is a fixed distance of 33 centimeters. Finally, pros and cons. Pros. It is a quick method of checking the heterophoria or small heterotropia for near. It is easy to administer. It is not a difficult skill for a clinician to learn. The Maddox Wing not only measures horizontal and vertical deviations, but also torsional, which differentiates itself from other tests. It can also be used for kids. Cons. It's unable to test patients with ARC and suppression. Size of deviation can differ due to its dissociative nature of test. Measurements may sometimes be misleading. Doesn't differentiate between latent and manifest deviation. It requires a CT to confirm. The scepter bends easily, allowing one eye to see both arrows and the numbers. This affects the test results. The Maddox Wing is fixed at a near distance, so it cannot be formed at far.
Okay, that'll be it. Thanks for that.
No worries.
Well done for today.
This is the end of the video. Thank you for watching. Noted.